I just wanted to jump in and invite the entire team of the Rural Health Committee to answer any of these questions. And the first question we have is asking about secondary impacts. So what are the secondary impacts that you found due to hospital closures? And Randall addressed a lot of these, but the particular question is also, were there any secondary impacts that were particularly surprising to anyone on the committee?
Yeah, can I jump in? I guess this is a secondary impact. It's one that Randall mentioned, but was a surprise to us that the community people who came to our listening sessions, even though they obviously were very active in their communities, either elected officials or community volunteers, most of them were completely surprised that the hospital was closing. So we learned that in some cases, the impending closure was actively kept secret from the community, which of course has a lot of implications on the community's ability to respond or plan for the closure. In fact, in a lot of cases, hospitals actually spent money on new furniture, hired staff, etc., right up until the closure, which had the effect of letting the community think everything is fine when it wasn't.
We have another kind of question, two questions that go together. One is, how can this work be used to help gain more support for rural hospitals? And in particular, Tracy went over a lot of different things that state, local governments, and nonprofits can do to help. But have you all thought about how you can leverage this work to garner more support from those entities? And also, is there anything that individual people on this call can do to show their support for rural hospitals or help garner more support?
I think that's a really important question. It's one that we're, working, to answer with our board and with others in our organization. We are going to do a white paper as part of our toolkit, and that will be mainly focused on some of these policy suggestions that Tracy summarized. And that toolkit will be sent out to all our legislators. But I think before we do that, we want to share what we've learned, with the groups that we talk to in these counties, and make sure we're not missing anything, get their assistance in prioritizing, those list of recommendations. And, but then, we do intend to present it to the legislators and to begin to continue the dialogue that Tracy was mentioning, and try to come to some consensus on where we need to start on all this. Anybody else want to add to that?
Yeah, let me just jump in. One of the things that was in Tracy's list of recommendations is the Rural Hospital Transformation Act. So this is an act that the legislature put in place to provide small grants to community hospitals and communities to plan around a closure. What I'm speaking maybe, as someone who's been talking to people about this issue, that is nothing compared to what's needed in terms of a rural community losing its hospital. So in terms of ways that the panel and the general public can help, I would say be very skeptical. Keep a critical mind when you see the legislature put something out there that might represent a small amount of money that kind of is related to the problem but doesn't solve the problem. I think we're going to have to put their feet to the fire to get them to really respond to this issue.
Well, and getting back to the community engagement piece of all of this, like I was saying toward the end of the list of recommendations, and it goes back to what Barbara is saying, is just really reach out to those policymakers and hold their feet to the fire and say, this is what we need. You said you were going to be doing X, Y, and Z. Tell me what you've done to make progress toward that. And I think the other thing is really coming up with a set of metrics. Right now, I feel like we have things that are looked at maybe by statewide organizations and whatnot that are very beneficial. And they go back to what Leah presented with the county profiles. But until everybody's kind of on the same page with those and understanding that the social determinants of health really drive so much of this issue, and that it's not just a question of giving hospitals money. It's, you know, for rural communities to be healthy, we have to address all of these things. And so reaching out to the legislators and, you know, even your local school boards and whatnot, you know, ask them where they're putting their dollars and toward what programs and how that's affecting students, and whether it's their school lunch program or their health education or their fitness programs or whatnot. All of those things come together to make a healthy community. And so again, it goes back to that community engagement within the community and on the broader scale with state legislators, and even eventually reaching out to your congressmen and senators as well. So
a couple other things we've talked about and you know, intend to pursue, but you know, we would probably need to work some of this in collaboration with some of our partner organizations, but to take a good look at the state budget and to see, you know, where, you know, the funds are coming from, where there are funds available to support rural communities. For example, I was just talking the other day to one of the mayors out in Upper East Tennessee, and they were able to get funding for a new ambulance, not from the Department of Health, but from a community development block grant. There may be sources of funding like that that could be bundled together and, you know, invested in some of these rural communities to help them rebuild their service network. You know, so that's important. Every community we talk to, as Tracy mentioned, brought out the issue of problems with opioid addiction and how that's been complicated by COVID is another example. But when we looked at, you know, the services available in the hospitals there before the hospitals closed, I think only one hospital even had any beds for any sort of substance use treatment. So there was a disconnect there. How do we get, you know, funds for the mental health safety net invested, and how do we get those coordinated with other services in the communities? You know, that's another issue that, you know, I think is going to be really important, you know, to align the services with the needs that people are seeing and talking about.
We're also monitoring. If you want to raise your hand, we'll try and grab you for a question if you haven't put it in the chat box.
Or an
Yeah.
answer,
Okay.
because we know many of you have been looking at this issue too, and we'd appreciate your thoughts on where we need to go with this.
Tony? Oh, sorry. Go ahead.
I was just going to say, I think there was one question that I would be helpful for understanding this process. And someone had asked, you know, why were these hospital closures kept a secret? How did that process go? And who implemented the closure? Is this related to who owns the hospital? Just help us understand that process of how it can be kept such a surprise.
I was really glad to see that question in the chat box, because it raises something we didn't cover in our presentation, but this issue actually has some bad actors involved. So as Tennesseans, we tend to expect the best from each other and see the best in each other. But this is a complicated issue where there's a lot of money at stake. And sometimes a hospital corporation will actively keep this quiet because they don't want their patients to leave. They don't want their staff to resign before the day they close the hospital. Not fair to the community, not fair to the staff, but that will happen. There are a number, this may come up later in the questions, but there are a number of other even worse examples in this situation of people disobeying the law, cheating, lying, etc. And then Tennessee residents have to put up with the results.
This is Tony Gar. I just got really a question for the panel. First of all, this is just super information, and thank you very much for your 3 years of hard work. I really appreciate that. So this is a question that I don't know the answers to, but you look at the Transformation Act that's passed. It's my understanding that that's actually being administered by TennCare. Then you look at which organizations on the county level know all the stuff about social determinants of health and what are the healthcare needs. And generally speaking, that's the public health department. And then you look at the annual reports that are due for hospitals, those go to the Department of Health. So you got the Department of Health, you got TennCare in a different department. It just sort of seems like, I wonder if even on the state level, you know, how much communication there is. And it's also the broader question, when you all did this study, was the local health department engaged?
We had representation from, I think, one health department. We invited them all to come, but I think in the conversations, there was only one health department formally represented in the discussions. This was a local public health department I'm talking about. But we did have interviews along the way with people at the Department of Health and Rural Health. We had interviews with the Health Services and Development Agency, which administers the Certificate of Need law. And we talked to people at the health department and emergency medical services to, you know, try to get a context for what we were doing. You know, it does seem that there, and, you know, I guess this is inevitable and, you know, a lot of, you know, bureaucracies, but, you know, there definitely is some siloing. And, you know, that might be one place where we could, you know, try to pull, you know, departments together. Now, I know there's also some work being done by the governor's healthcare transformation task force on this issue, which I think is a way of pulling together not only different areas of a department, but different departments to look at this. You know, to date, I don't think they've, you know, published, you know, any recommendations, although I think it's something they're working on. I don't know if anyone, you know, would like to contribute some insight into that, but, you know, we would certainly want to communicate what we've learned to that task force and, you know, try to see if what they suggest to address it. Telehealth is one thing I have seen them, you know, talk about. But, you know, I'm not sure what the level of engagement is between that task force and some of these, you know, county mayors and county health departments.
This is Rich. I see a question in the chat from a participant in one of the listening sessions that I was wanting to address. This is from Jeff Tibbles, and he says that that the legislature is asking for.
Oh, Rich is muted. I was actually hoping to address that question next. I was going to invite Mr. Tibbles, if you wanted to unmute yourself and ask your question to the panel. I'd invite you to do so now.
Okay, I'm here.
Thank you.
The biggest thing that we talked about, I think the gentleman before that I'm talking now was, can you hear me?
Yes.
Yes, he was mentioning something that I was asking about the Healthcare Modernization Task Force. At that meeting, one of the meetings, Tracy Stansberry was also at that meeting, and she heard it, and we were both kind of stunned, but it kind of hit home when the senator said,
No, I'm not.
You know, give us something that we can work with. We've all heard of all these great ideas, and they're nothing new. Give us something the legislative body can work with and act upon. So I'm just curious what the THCC has that can fulfill his request. And another thing, I know there's a big push, and I agree with it to a degree, with the legislative body passing Medicaid expansion to, I think it's like $2.8 to $4 billion. They're working to try to get CDBG grants that will cover up to $8 billion instead of just the 2.8. Of course, all of that would help. The problem is you've got a predominantly Republican Party ruling the legislative body in Tennessee. So if they were to be asked again, which I've written them numerous times, my local representatives and senators, to consider it further. And I think it's just tough for them because they consider it associated with the Affordable Care Act, which I hate the term affordable because it's far from affordable, but they consider that as giving in to the ACA. So how do we handle that? The next thing, when we talk about available funds, the state legislative body has been using for the last 20 years the tobacco industry settlement funds to balance budgets, and rarely have used those funds for what they are intended. If you look like Scott County and other rural areas and distressed counties, tobacco use is probably one of the major factors that causes health issues and chronic disease. I mean, that's something in my mind that the state needs to be asked to use that money where it was intended, because cessation programs do work and they're just not being executed. And I'll stop there.
I think with regards to that tobacco settlement money, again, that goes back to everyone holding the legislature accountable for what they have available and their use of resources. And so I would encourage other members on this call or participants to reach out to legislators and say, hey, this is a source of funding that we're not seeing at the local level. And, that might be one of those exchanges that might be beneficial. But going back to the political feasibility of Medicaid expansion, that's going to be a tough nut to crack. And our group, I think, in continuing to advocate for that, is hoping that chipping away at it is going to eventually result in something. Hard to say exactly.
I wanted to say that in terms of other things, one area that I remember came up in several of the listening sessions was this issue of kind of regulation and education of the owners and managers of hospitals in the state. People have had bad experiences with hospitals. It's not just a matter of the hospital closing, and it can be open and closed and open and closed, as you know, up in your neck of the woods. And the question of the state having more teeth in their regulation of what an operator of a hospital is required to do, and those sorts of things. That's another area. And the certificate of need law is also an area that has a big role in this topic in terms of what the state, how the state uses that power to try to deal with some of these issues. So those are a couple of other areas, I think, where there's there might be better ways of working together. It is true that the Medicaid expansion is probably not the best place to start with the current legislature, but it is something. I mean, one solution. We don't want to throw money at every problem, but one solution here is that there needs to be an input of money into the rural health system, and the state doesn't have a lot of extra money, and so the question of where you get that money is pretty key, and so that federal money on the table is a big. If you're not going to take that, you're going to have to come up with money somewhere else.
Another thing that may be not as costly that we heard in the listening sessions is that community people feel like the state is away without leave on this issue. So a small rural community learns that its hospital is closing, and the opponent, the owner of the hospital, is part of a multinational, perhaps international corporation. And the small rural community doesn't have the resources, the backup to figure out how to deal with them. At the moment, the state is basically hands off with the community. They're not involved. The communities are asking for some kind of champion at the state level, and they thought they would be getting it from the governor because he had come into office with a commitment to rural communities. They haven't seen that, and they're looking for that. So that's one way to do it, would be something coming from the executive of the state that would really support rural communities when they're in this position of losing a hospital or about to. And another option would be a legislator or a group of legislators, Republican or Democrat, who would be champions on this issue, who would come together and say, our rural communities are really getting the short end of the stick. I'm going to step up there and see what kind of real relief there might be to work out this problem.
You know, this, one of the themes that appears to be very central in our discussion is ways to build the capacity of these rural communities in order for them to know how to engage in community action and advocacy. Because that's where the push occurs. But, and as Barbara just mentioned, having someone who's a champion, it starts at that grassroots level of people knowing how to speak for themselves and how to create an action plan in order to be able to do a lot of the things that we're saying, particularly a lot of the initiatives that Tracy mentioned. It's going to require the community actively engaged in the process. And so for me, I'm thinking as you're speaking, some capacity building grant where we begin to train these communities, spokesperson and stakeholders and gatekeepers of how to navigate the residents when issues like this happen in their communities so that they'll know what to do. Because we know, because we are in it and we're reading about it, but it's not as easy for some of these communities to know how to even galvanize around an issue to demand that they get the kind of services that they need.
One thing I was struck by, to respond to you, Vilma, is, you know, as we talked to each community, there was really a sense, and Barbara mentioned this too, of abandonment. And I don't think, you know, the communities, you know, realized that they weren't the only ones going through this. And, you know, one thing I think would be important to do is to connect, you know, these communities in different parts of our state with each other, you know, to realize that maybe, you know, their voice, you know, if they could, you know, speak together, that might be more powerful as well. And I don't know if, you know, if that's a function, you know, how to overcome that. I know the state does have regional organizations that might be a start, a way we could begin to network these different counties to speak with one voice on, you know, some of these issues. But I think that's really important.
Let me speak to that. Just, well, there's been a number of questions that are all tied together about the rural hospitals, and invariably when we visited these 6 communities and talked to people in other communities about their hospitals, the one common thing that led to a hospital closure is a lack of paying customers. I mean, that's the common thing. When you get into the rural communities and you're away from the big industry that provides insurance, and you get away from the wealthier folks that are able to buy their own, and you get down into people that are in the lower income levels, they don't have insurance. And when they go to the doctor or they go to the hospital, they wait till they have to go because they don't have the money to pay, and they don't have the insurance to pay. And it's the little hospitals that don't have the big clientele of insured patients that bear that burden unequally. And our government is not recognizing that, either at state level and quite frankly at federal level too. But it's the lack of money. So we can send in a task force from Chicago to meet with the local hospital group and the local community to figure out their problem. And they're going to tell them, you're not bringing in enough money. Well, they know that. That's not what they need. They need the money, and they need a way to bring it in that they don't have the funds to already finance. What we've got to do, in my opinion, to fix it, is we've got to devise a way to bring available monies from whatever source into those communities to help support those hospitals and the local population. Now, if that's offensive to some parts of the political spectrum, I'm sorry, but that's what's got to happen if we're going to fix it. Now, how you do that, is another question, but it's got to happen. If we don't have the money, then the hospital can't survive. It's just that simple. Someone has to support it, either through paying customers that have insurance or through subsidies or something. My looking at that, and we try to stay totally nonpartisan in our work, but if we have legislators on either side of the spectrum that do not want to really address the issue, and the issue is not having enough paying customers, then we have to figure out a way to change their mind. And the way to change politicians' mind is when it becomes in their best interest. And it becomes in their best interest when enough local residents that are their constituents say, look, buddy, if you want to stay in that important position, you need to support your local community. And here's a serious problem that we've got to resolve. So from my perspective, thanks.
I'd like to confirm what Randall just said and add 2 additional points. One is, we covered this a little bit in the report today. When the hospital goes away, business has trouble. So actually the community is moving in the opposite direction in terms of bringing in business revenue because businesses close down. So that's a dynamic that has to be addressed. The other thing is that we didn't really talk about, but nobody was telling us that every single county needs a hospital. We're not saying that, but every county needs some kind of way to respond to its citizens who are in distress. So it might be a smaller facility that is staffed, that is a holding facility for someone who's had a stroke, waiting the 2 or 3 hours for the ambulance to arrive. We think, and we know that in other states, there have been creative solutions to address the care needs, but that our state somehow has not stepped up to the plate to allow for these creative solutions. That's one reason Tracy mentioned in her piece of our presentation, certificate of need review, that the certificate of need has been changed in Tennessee so that there's less and less citizen input into the certificate of need process. So as a result, it's not really meeting the needs of citizens in all of our counties. So we have to kind of break out of this and allow our state to be more creative, more innovative, with an eye on the ball of meeting the health needs of rural citizens.
Thank you, Barb and Randall. I'd like to invite Kathleen Malloy, who's asked a couple of questions in the chat, to unmute herself and ask her questions. If you're able to do so, Kathleen.
Hi. Thank you for recognizing me. First, kudos to Claire and Tony Gar. I've lived in Tennessee on and off for a few years and had my start in legal services. So, so I tend to kind of, as you might have seen from my question, ask about public shaming and who's connected because it's always about money. A couple of folks have said that it's always about money. It just in terms of leaving these communities high and dry. So I don't know if there's, you know, any reporter who might be willing to write a story. The gentleman earlier mentioned getting the attention of the legislatures. Sometimes, you know, a money connection, giving someone a pass about not having to warn the community about a closure. Another woman mentioned laws broken, and I'm sure there have been. If any of these strategies in terms of getting the attention of a few legislators as part of directing some money or demanding accountability is feasible.
I wanted,
I'll mute myself. Hi, Claire.
I wanted, you know, just to add a little bit to that. I'm not sure I have an answer, Kathleen, but one of the things that struck me in our conversations with some of the hospital administrators who had come into Tennessee from other states, each of them said, you know, without any prompting, that Tennessee was so different because in other states, the hospital systems work together with the communities. They work together with the state. There was planning, there was collaboration that they found missing. They felt, you know, Tennessee was one of the most competitive environments they'd ever worked in. Kathleen mentioned, you know, we're the home to HCA and Community Health Systems and Tenova and all these other organizations. I really don't know if that, although I would suspect, you know, that does contribute to the culture here, which makes it different from other states. But how we reverse that, maybe it will take some, what you term public shaming, Kathleen, I don't know, but, you know, calling out that, you know, that difference and you know, challenging where that comes from and why can't, you know, we sit down together and say, well, this county needs at least a freestanding emergency room. We could provide that and do it in a way that wouldn't exclude networks from other, you know, carriers. You know, we don't have any laws here about network adequacy in our state, you know, to make sure that, you know, every community, you know, has access to an emergency room. Of course, you know, the ACA protects that, but I don't know for how much longer. So, I mean, you know, there's just, you know, a lot of these issues are intertwined, but.
This is, sorry to interrupt you, Claire. I'll add one more history item, which Tony will know, and maybe Gordon Bonneman and maybe the Tennessee Justice Center. You know, when we did Medicaid managed care, we said, come on down to the state, and all these ridiculous private managed care companies rushed down there. Half of them crashed and burned. So this approach of Tennessee, careless, you know, come on and compete, and that's the best way, goes back a ways. So maybe that's not very helpful to look back now, but I don't know, perhaps kind of an overview, a short history of Tennessee's behavior since, you know, the 80s and failures constantly would be a tool of some kind, especially if you can find some through line with who got the money, who got the profits, who opened up, you know, who in the legislature. Anyway, it's just, you know, a thought. Sometimes it's fun to be able to hit people over the head.
Does anyone else want to share any thoughts about, you know, about this? You know, please, we're
I have, this is
very
Tom.
open to it.
I have just another thought. Once again, I don't know the answer to this at all. But if, say, a chain, hospital chain, wants to come in and buy a rural hospital, does the county mayor or the city mayor, are there county or city laws that, in other words, when they purchase that hospital, the county and city has some leverage with that institution, requiring them to do certain things, notifications and things like that? In other words, they're buying a piece of property that's owned by a private individual, but are there laws that county or city laws that would require that institution to have this dialogue and, you know, and be in communication? So it's a broad question. I don't know if anybody on the call today has the answer.
Tony, let me jump on that just a little bit. And that may be a big part of our problem. You know, historically, our rural county hospitals were owned either by the county or by a religious institution of some sort. And they were nonprofit. And there are some provisions in the law that when a county-owned or public-owned hospital is sold, particularly if it was created under Hill-Burton, that the profits and the money from that has to go back into the community and healthcare. But in Tennessee, if it's a privately owned, corporate-owned hospital, and they want to sell it to another corporation, I don't think there's anything other than the licensure and if they just pass the licensure on, that the state gets involved in it at all. And since it's state regulation, I seriously doubt that the county or city could intervene if it's a corporate-owned hospital. And what's happened here in Tennessee is as hospitals have moved from publicly owned into the corporate world, the goals are different. The goals from the corporate world are a certain amount of return to their shareholders and their owners. And rural hospitals don't have much return. So they close them or they sell them off to someone else. And we've seen in Tennessee and in neighboring states too, where when they're about to close, we have some unscrupulous operators that come in and buy them up with no experience in operating a hospital. They load them up with additional mortgages. They try to play games with billings through the CMS systems to take advantage of that. Then when they bled them dry, they let them close. And that's happened in Tennessee. It's happened in a number of other states. And there needs to be some regulatory work done there. And we've heard in our listening tour, we heard quite a bit of that. And Barbara mentioned it, but it seems that in some communities, there's an outcry from the local governments and communities that we need some help from state government or federal government or somebody, that someone that has no experience in operating our hospital can come in and buy it and let it go down the tubes. But right now, I don't think there is much.
Mayor Tibbles, I was wondering if you would want to lend your perspective to this conversation as representing the mayor of rural county.
When it comes to like back in, when I was in office from 2010 to 14, I walked in 2010 and the hospital had just made, which was a St. Mary's entity at that time, who had been bought out by HMA, I believe was the firm. And they came in and they said, well, we're closing. They took their rent, so we were collecting $1 million a year in rent. They took that and said, we're not going to pay you any more rent. And then they announced, well, we'll fine with that as long as you keep operating. And in the end, they said, well, we're closing. You got 6 months to find a new operator. And in the meantime, they had found an operator, which thank God we didn't go with him because he's now in jail in Mississippi for fraud. But luckily, we researched him well enough to find out there was an issue with him, so we didn't go with him. So then we started the problem of finding someone that HMA could actually agree to work with. And the big problem we had there, they would not transfer the provider numbers over without indemnifying. They wanted to take all responsibility for all cost reports over the last 4 years, which was a liability issue of around $7 million to the new company. That was a showstopper for them. So then it came down to, we're back to the drawing board again. So we ended up going with about $400,000 in legal fees, doing everything possible to make sure the transfer. We finally cut a deal with Pioneer out of Mississippi to for them to take the hospital, but to have strict controls over them, requiring them to stay here for 10 years and maintain services to list level and that level. And just operate the hospital with employees. It was going to be around 200 employees. What happened was they found out, they realized that the profits first weren't there for them compared to their other 7 hospitals, and they just filed bankruptcy and left us high and dry with no warning. And then the new group comes in and buys them out of bankruptcy court, which took, I believe, Ms. Stansberry can help me on this one, I believe 2 or 3 years for this to happen, for them to get the agreement with the bankruptcy courts. And it was actually a purchase from an entity that does nothing but diagnostics, no hospital experience whatsoever. Now they own 3 of the hospitals in this area, 1 in this county, 1 in Fentress, and 1 in Campbell County. The one in Fentress County is obviously closed. But both the ones here in Scott County and in Campbell County are struggling. I don't know if I answered your question or chimed in on what you wanted to chime in on. So good question.
I think that's a perfect example. You know,
I think everybody on the calls, their eyes are popping out of their head right now, having heard those stories. I mean, we heard them from you before, but they're a perfect example of how difficult it is, that it's not just a matter of money. It's not just a matter of lack of education. It's not just a matter of better regulation. It's all of these things together. And there are other things too. I mean, there's, some hospitals, some communities would have better healthcare without their old hospital, but with something else that really meets the needs of that community. And then there are issues between the centers, where the specialists are, and the big machines are, and the hospitals, and how those people relate to each other, and whether they're pulling resources out of the rural hospital or putting resources into the rural hospital, and getting all that balanced. It's so many different things. That was what I learned when I got involved in this, that it's a really complicated thing with a lot of balls in the air. But a big one is what you just talked about, is how to deal with these operators who want to come in and save you, or who want to make a lot of money, and or whatever their motivation is, but to work that out so it benefits the community.
You know, Mr. Tibbles can correct me if I'm in error, but I believe in that case in Scott County that the federal bankruptcy court actually awarded the sale of that hospital to the laboratory company over the objections of the local government.
Yes.
It was more than, I mean, what could they do?
Well, when we sold the hospital back in 2012 to the Pioneer Group, had our problems taken care of because they had a history of successful operations, especially critical access hospitals. And that's what our hospital was at that time. And well, of course, that process once again took 16 months after the transfer of ownership from HMA to Pioneer, which was another problem, cut down on revenues that they could have been making when they opened the doors. There's other issues that when we worked our tails off trying to get, and it was like I've said at the health task force meetings, it was the second hardest day of my life, which was to shut down our hospital and send 200 people home. But it was the only choice. They put us in a bind. Their lawyers in New York City thought they had us over a barrel, which they did. But then they were asking for us to pay them, I believe it was $1.8 million just to keep the doors open for 3 more months, which there's no way physically the state legislature or our comptroller would have let us do anything along those lines. So I had to make the decision with the agreement through legal advice that tell them to do what they have to do. And that's what I did. And we went, and that's when the fun, if you want to call it that, really begun. And Ms. Stansberry was involved in a lot of this along the way, and she can comment further on it if she would like. She's more articulate than I am.
Well, I think that it really circles back around then in terms of the community's trust being really damaged through this whole process. And so, you know, we've been on this roller coaster ride that Jeff described, and with this new company that doesn't have the experience operating hospitals, you know, they seem to have this astonishment that there are people here questioning their motives. And that's really been an eye-opener for me, that they don't seem to understand that they really need to reach out in the community and be a part of things. And I'm starting to see a little progress on that front, but there's so much more progress that needs to be made. And it's not just a one and done deal. It's going to be something that they have to maintain if they wish to be here for long. and you know, and then it goes back to the community too. We, I think, all have a responsibility in being a part of that dialogue. So it has been a roller coaster ride, I'll just say that.
I'd like to take the opportunity to pose a question to the whole group, because, you know, we've got such a super diverse group of people here with different kinds of experience. But one of the things that our rural equity team has been considering is, as Claire mentioned, is there a way to somehow bring rural communities in touch with each other so that they can have more of a voice, whether they're from Washington County up in Northeast or Gibson or Haywood in Southwest, so that they can share their experiences and be a united group, either in approaching the legislature or a bad actor who wants to take over a county hospital. Is that a feasible idea? How do you respond to that as a possibility? Can we bring people together, even if it's virtual, with a bunch of Zoom calls? Would that work?
This is Kathleen speaking. I know that there have emerged, and particularly with the oversight and help of the Highlander Center up in Upper East Tennessee, of community-based groups working on a range of issues in terms of pay equity and voting rights and et cetera. And so, and are really connected across a lot of Tennessee counties. So I wonder if trying to connect with an already existing group around this issue, so you don't have to create a new group, but and the idea of access to healthcare services and affecting rural communities and what the social determinants of health. I mean, there's an obvious connection with the issues, but taking advantage of an existing network that's already quite active. It might have to, you know, obviously election's going to be over soon, but that might be one vehicle to try to pull this kind of a connection together around the rural hospitals.
We're actually hoping to mobilize the voices of the people we heard. So that you're right, Kathleen, there are several groups that could support that. But can we be effective in bringing together people from Gibson County and Washington County, et cetera?
I think we're getting this signal that our time is almost over, but, you know, I think, you know, there are ways that we can certainly continue this conversation. I think it's an important question Barb's asked, and, you know, we've got so much collective wisdom on this call. It would be really helpful to hear what you think. Does anyone on the panel just want to say a few parting words? And then I just want to, we have a few extra announcements to make at the end here.
I would like to, Claire. We've got a serious problem. We've got one of the most serious problems in the country as relates to rural healthcare here in Tennessee. When you combine the highest level of closures of hospitals with the opioid crisis and the COVID crisis and a whole lot of poor people, we have 15 counties that are considered distressed, which means they're in the lower 10% economically in the nation. in Tennessee. We've got a serious problem. And where I want to go with that, and Barbara just brought it up, there has to be a way that we can connect good thinking people across Tennessee that are badly affected by these problems without bringing the politics into it, either left or right down the middle. But talking about what's in the best interest of these communities, the best interest of their health care, the best interest of maintaining their hospitals and building economically out there. I don't know. I don't have the solution of how to do that. But it seems to me that if these rural counties, leadership and citizens can get together from one end of this state to the other and demand better service from locally, from counties, from the state, from the feds. I mean, our people are important, and it shouldn't matter which political party you belong to or don't belong to. If we're focused on bettering the situation of our folks and our people, then I think that's what's important. And we're going to consider ways to do that. Can we do it? I don't know. Really don't, but we've got to try. So thanks everybody. From me, thank you for participating in today. We really do appreciate you.
I did want to say thank you as well, and we'll continue this conversation. I mean, maybe we'll even schedule a follow-up Zoom call for those of you who want, to help us think this through and develop the best strategy. I did want to ask everyone if they would be willing to do two things. One is to help us get the word out about open enrollment starting. I mean, maybe wait till after the election, but open enrollment starts tomorrow. And there are many people in our state who are eligible for plans on the Affordable Care Act, eligible for TennCare, who haven't taken advantage of those opportunities. And we can help connect people with assistance statewide. We have an 844 number, 844-644-5443, that's manned by our volunteers. And if people want some assistance in reviewing what's available on the Affordable Care Act at this time, or finding out about their eligibility for TennCare, we can help facilitate that. So if you could spread the word about this, it would be a big help. And the second thing is, to please evaluate what we've talked about today. I think we have a slide that has a little barcode on there that you can scan to take you right to our evaluation page on our website, or you can go on the website and look at the session and find a link to evaluate it. But this would be really helpful to us to get your ideas about how we move forward with this. We will be getting a toolkit together, as Tracy mentioned. We'll let you know. We'll keep, if you don't mind, your email addresses. You'll be the first to know when we get that posted. You can look that through, see if we're missing anything. It's going to be a work in process, and we'll continue to make resources available to communities. But I think I feel more committed now than ever, to making sure that we find ways of connecting these, communities and moving forward together on this issue. So I think that's all. Again, thank everyone so much for their time and participation. If any of the panelists want to add something, please do. All right, well, thank you all. Needless to, I don't think I need to say this, but I sure hope you'll vote or get someone out to the polls who hasn't voted yet. It will make a huge difference, in where we can go as a state, depending on the outcome of this election. We are going to have another session, one last one in our series. It'll be on November 14th. Hopefully we'll know the outcome of the election by then. And that session is going to address how we close the coverage gap, what what are the options, and what are some innovative ways of getting there. So I hope you'll join us for that last session. And once we know the outcome of the election, we'll have the panel posted on our website so you can see who'll be presenting. Thank you so much again for your time.
And Jacqueline has a link to complete the evaluation for the event. Please do that before leaving.
Okay. All right. So yeah, check the chat box for the evaluation link. All right. Well, happy Halloween, everyone.